Hi, I'm Dr. Dabbs. Today I want to go over what findings that we have in our office that we found when we tested you the other day. What we try and look for in the body is some kind of imbalance going on in the body, and quite often it has to do with muscles, joints, and ligaments. And basically what happens is the spine, for example, has all these nerves coming out of your spine, and it goes to all your organs, so it really controls your health, but it also controls all the muscles in your body. And when you have a spine that's out of place and it pops out like that, I'm exaggerating, then we have to put that back in place. And it could be any one of these vertebrae, and the doctor's going to come in and tell you which ones they are. But when a vertebra goes out of place, it pinches on a nerve. And that nerve can cause pain in the neck, it can cause pain in the lower back, it can cause pain all the way down into the organs, down the leg, down the arms. And what we want to do is we want to take this vertebra and get it back in place. But what happens is it's stuck, it doesn't move. I'll demonstrate. You have your spine supposed to move like this. Yours moves like this, so it doesn't really have good movement in there. And what we need to do is loosen it up so it gets like this. And we do that what's called spinal adjustments, where we manipulate the spine, get the joint moving again. So it feels good to do this. We pop bones back in place very gently, and it feels good, and it just takes a few ounces and it gets the joint moving again. However, it's going to pop out again, maybe in a day or two, just not as much. We put it back in, you feel good, it pops back out. We keep putting it in, you keep popping it out, eventually it stays in place and it moves properly, takes the pressure off the nerve, and it undoes the damage in here. The damage that can happen if you leave it is called arthritis. Arthritis is basically when you take a joint. If I took this little joint out of my back, and it could be a knee joint too, or an ankle joint, it ends up looking like this with spurs in there. And you may have this started already. Doctor will go over that with you. But this is arthritis, and this is painful. We actually can reverse arthritis some, so we want to catch it early so it doesn't get unbelievable pain. You don't want that. You want to get this thing fixed fast so you don't get pinched nerves, don't get pain that's with you for the rest of your life. Our job is to get all the joints moving properly, all the muscles rehabbed and strong and flexible. If we can do that, we'll get you better. It takes about 12 weeks. If you break a bone, for example, and you put a cast on, it takes 6 weeks to heal a bone. Well, soft tissue is twice as long, less blood supply, so it takes about 12 weeks to heal you. So there's two kinds of treatment we do, just pain relief, or we can treat the problem and fix it, and it's called corrective care. That's the better kind, because that means it won't come back unless you have a car accident or some other trauma. But we're going to train you on proper ergonomics and lifting and bending so that it doesn't come back also. So that's basically what we're going to be doing with you. Your doctor should be in to go over your findings with you. Thank you.